Hey there, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. We specialize in braces and Invisalign and creating awesome smiles. I wanted to show a case to you today because it illustrates a really great point. One of the really common complaints that we get from people coming in is that they feel like their front teeth stick out too far. We call this protrusion, that the teeth protrude out too far, they flare out. And that's what JB wanted to change about his smile. Now when you look at JB here, he's a good looking guy. You can hardly tell that his front teeth protrude out. Even if I show you the close-up of his teeth, it still is a little bit difficult to tell that these front two teeth stick out excessively. I can see that, but that's because I look at teeth all day, and I'm assuming you don't look at YouTube videos of teeth very often. But if you look from this angle, these are his upper teeth, and like we're standing on his tongue and looking up at the upper teeth, and you can really appreciate how far out in front of all the other teeth these two front teeth are. And so now you begin to see it, and I think you'll see it even more from this vantage point. This is looking from his right side, and you can really see that these upper two front teeth are not only in front of everything else, but they're also flared way out, and they kind of stick out. And so this is exactly what JB wanted to change. Now, when we have conversations with people who want their upper front teeth to stick out less, we usually talk about a couple of options. One is you can widen the upper arch, and that'll bring the front teeth back. But the effect on that is somewhat limited. A second option is that you can actually alter the shape of the teeth. You can make some of the front teeth a little bit skinnier, and that allows you to close the spaces and bring some front teeth back. But if you really want to see a nice change, sometimes the best way to do that is to take out some teeth. And for many people, talking about taking out adult teeth is a non-starter. And I get that. It's not an experience that anybody wants to have. It's not an experience I want for any of my patients or any of my children. But sometimes it's the best treatment. And so in the case of JB, I recommended that we take out two upper teeth. So it would be this tooth kind of in the middle of the arch and the corresponding tooth on the opposite side. And on the bottom, we took out the same tooth, the one right below it, and then we closed spaces. So let me show you what the result of taking out those teeth and then closing the spaces, what that looks like. So here's his front teeth when we were finished. And again, you don't see a really dramatic change from this vantage point. But if you start to compare it, you can tell that these front two teeth don't stick out as much now as they did at the start. You can really appreciate it from this side view, how these front teeth have come back and they're not as angled out. Again, I just want to reiterate that when you take out these teeth, you fully close the spaces such that you can barely tell that there's any teeth missing. But if you count the teeth, you'll notice that he's missing these two right in the middle here. Here's another vantage point, looking from the tongue, looking up at the upper teeth, and I think again you can really appreciate how these two front teeth, they don't stick out as much as they did at the start. Here's JB at the end, and I love his smile. First of all, he's just a really good guy, really great personality, and now he's got the smile to match it. So we're really happy for him. His family was really happy with this result, and he wanted a dramatic change in those front teeth. And so taking out two upper teeth and two lower teeth was absolutely the right call. It gave him a fantastic result, and I don't think we could have had a result like it doing anything other than taking out teeth. So we don't take out teeth very often. It's not something I recommend very often, but especially when it comes to protrusion of front teeth, it can be a very effective way to create a great smile. So hope you learned something today, and hopefully the point that you learned is that sometimes you don't need to be scared of extractions. Sometimes that's the right treatment plan for the patient and the right treatment plan to address the patient's chief concern. So thanks so much for listening. Have a great day.